This podcast is brought to you by Conquer Cancer, the ASCO Foundation. Our mission is to accelerate breakthroughs in life-saving cancer research and empower people everywhere to conquer cancer. You can make a gift at conquer.org/podcast. Imagine receiving a cancer diagnosis only to be told that not only has it already spread to other areas of your body, but that it's also one of the rarest cancers in the world. Katie Coleman doesn't need to imagine this. She lived it. In December 2020, at just 29 years of age, Katie was diagnosed with metastatic oncocytoma, a type of rare kidney cancer. So rare that fewer than 10 cases have been recorded in human history. Consequently, it's also remained largely understudied and overlooked in cancer research. Luckily, Katie sought care from Dr. Pavlos Msaouel, a two-time Conquer Cancer funded grant recipient with an incredibly niche research focus targeting rare kidney tumors. Katie and Dr. Msaouel collaborated to make informed decisions about the best treatment approach, including the pros and cons of clinical trial enrollment versus standard care. Now a cancer survivor and thriver and patient advocate, Katie has made it her mission to share her story and help others learn to more effectively navigate cancer care. In the process, she determined to empower shared decision-making between providers and patients. Katie, good morning. We are so incredibly grateful that you're on today. How are you doing?
I'm doing great. Thank you. I really appreciate you having me on, and I'm excited to chat with you today.
Well, it's an honor, especially during Kidney Cancer Awareness Month. We need to spread the word, and we know you are doing an incredible job since your diagnosis of spreading the word and communicating not only about kidney cancer, but about the rare type of cancer that you have, which is so important for people to hear. And we find in your stories that the most important thing is to hear patient stories and researchers as well. But today we want to hear your patient journey because you're young, you're vibrant, you're beautiful, you're married, you have the world ahead of you. What in the world happened? And how did you get diagnosed with kidney cancer?
Yeah, so I ended up getting diagnosed actually on New Year's Eve 2020. I had spent about a year and a half pursuing various symptoms. It just didn't feel right, but everybody seemed to think it was anxiety. My main symptoms that I was pursuing is I had high blood pressure, a rapid heart rate, and then I was getting very severe lower abdominal cramps in a cyclical fashion. So I was pursuing those symptoms for about a year and a half, and kind of everybody just thought that they were anxiety until I eventually started to feel a hard mass in my upper right abdomen because I had lost a bunch of weight. I lost about 50 pounds or so. And I was actively trying, so it didn't end up flagging a whole bunch of doctors to kind of do a further workup on that. But once I had lost all that weight, I started to be able to feel a mass in my upper right abdomen. And so I brought it up to a primary care physician. When they didn't seem too worried about it, I actually ended up going to an urgent care. And then at the time, I was worried I might have had an enlarged liver. There, they felt the mass, thought it was possible it could have been an enlarged liver, and they sent me to the ER. And then it was in the ER, once they put an ultrasound on me, instantly they found it. I had about a 12 centimeter mass, which is larger than a softball on my right kidney, and what would end up being about 15 or more tumors in my liver. It had already spread, and so was stage 4 at that point. And so kind of where everything started and branched out from there.
When they say it's rare, my friend had stage 4 kidney renal cancer, and she was at NIH for years, and unfortunately we lost her. But what's the difference between a regular kidney cancer and the specific type that you had?
Yeah, I'm glad you asked because kidney cancers specifically are so different from each other, all of the different subtypes that exist. Clear cell is the one that's most common, and that's the one that most people have. And then there's a bunch of subtypes that in the past have kind of fallen into a bucket called non-clear cell kidney cancer, which is a bunch of different types of kidney cancer inside of that. Mine actually didn't have a specific classification even within that other bucket. So in the non-clear cells, you have things like papillary kidney cancer, chromophobe kidney cancer, RMC. There's a bunch of different types, and they all respond differently to treatments, even though they're all kidney cancer. But what mine was it was actually an oncocytoma, which oncocytomas are typically benign tumors that can happen on your kidney. They themselves aren't super uncommon. What was uncommon was the fact that they spread. In my case, they typically never ever spread. And so that's where the 10 or so cases that has ever happened or been reported in, that's kind of what I was facing, was because my tumor looked exactly like an oncocytoma every way that we tested it, but it also ended up in my liver, which just never happens. And so there wasn't a whole lot of information or resources to go off of in the beginning, which is why we kind of modeled my treatment after the closest thing we could find to it, which is chromophobe kidney cancer, one of those other rare types of kidney cancer. It shares a lot of commonalities with it.
Interesting. I know for my friend, and this is 15 years ago, so obviously a lot has changed. They said that her kidney cancer was from asbestos because one of the leading causes of kidney renal is asbestos. And she had asbestos in her office. Do they have any idea where yours might have come from?
No, we don't really know. I mean, it could be questions of like exposures is always a question when it comes to cancer. Could it be environmental? We did a bunch of genetic testing for me. And so I don't have any like known genetic mutations, which can be common in some type of cancers. For example, HLRCC is a kidney cancer. You can test for that, and it's usually found in genetic mutations. But I didn't have anything like that. So we don't really know for sure kind of where mine came from or started.
Interesting. Take us back, that moment that you were told that you had stage 4 cancer. What were your initial thoughts? What was going through your mind? What did you do?
It's kind of crazy to think back on that moment in particular, because I had been going through the diagnostic process for about a year and a half. And honestly, I was worried that I had cancer. I brought it up to several physicians who all at the time told me that I was too young for cancer, which, understanding statistically speaking, my case is not necessarily common. I understood why they said that. They're trying to kind of rule out other things. As soon as I got the diagnosis in the ER, I was actually very surprised because I'd pictured a moment like that a million times because I felt like something just was wrong. And I thought I'd be terrified. But the very first emotion I felt was relief, because I felt like I had a doctor sitting across from me who like believed me for the first time. And it was like an acknowledgement of like, okay, all of these things I've been feeling, maybe they're not just all in my head. There actually is something wrong. And so now we have a plan forward. After that, the devastation definitely hit. I was 29. I was a newlywed. I got married just 2 months prior. We were building a new home. So we were really just like setting up our lives. And so that completely crashed all of that and felt like the rug just got pulled out from under me. So I was definitely devastated. I didn't really know anything about cancer at the time, especially stage 4 cancer. All the references I really had to go off of was like what I saw in books and movies and TV shows. And so I was petrified in the beginning, and I didn't really know what to expect, which was a big part of why I started sharing on social media immediately after I got diagnosed, because I didn't have a lot of information to go off of, but it was something that I was looking for to see what it was like to go through cancer. And so I started trying to leave some breadcrumbs behind. So in case anybody else ended up in the same shoes, that they could have some general idea of what to expect. Obviously, my case kind of has taken its own unique path here, but I was hoping that at least somebody else could have something to look to, since it's not super common to be diagnosed at a young age.
Exactly. I'm sorry to hear that they said you were young. That's extraordinary. But I understand, like you were saying, that they were just trying to rule other things out. Since it was a rare cancer, everybody runs to Google. Even though when I was diagnosed, I don't know if you know, I'm a breast cancer survivor. And obviously there's a lot more out in the world on breast cancer. But my oncologist was determined for me not to go to Google, because you can go down a road that is quite scary that might not be your road. But that said, it's validating knowing that there are others out there that have your disease state and are going through the process that you will be going through. What did you do since you couldn't go to Google? How did you gain knowledge? Because knowledge is power, as I see you shaking your head. And I felt the same way. Having a diagnosis that's definite and specific, and knowing the treatment that we're going to go down as cancer patients is empowering.
Yeah.
What did you do? How did you get the knowledge and the knowledge to feel confident that you're being given the accurate information, that you're going to be taken care of?
Yeah. So it actually took me months to get to that point because what I had was so rare. And so I actually had to fight back through my diagnosis and get many second opinions. And it was a combination of things that I did. I did initially go to Google at the beginning, and that's kind of how I recognized what I had was probably pretty rare. I was very fortunate that normally in a radiology report, they don't list what type of kidney cancer they think you might have had because it's really hard to tell from imaging. But oncocytomas in particular have a few key features. One of them is called a central scar, which my tumor had very prominently. And so they had listed the possibility of me having chromophobe kidney cancer or an oncocytoma. Again, oncocytomas are typically benign. And so I immediately started searching those terms when I got diagnosed and was able to see that both of those were relatively rare. So I had a hint off the bat that I might have something rare. I couldn't find anything directly related to me. And then not knowing anything about cancer, I took plenty of spirals going through Google and looking at overall survival stats of liver metastases and taking all kinds of studies out of context and everything there. And so there was one part of it that I did Google things. Some of those I went down some very deep rabbit holes, but I also, like when I got my pathology report back, that is how I understood what I had was really rare. I'm very, very fortunate that my very first pathologist also put very thorough comments in my report. And so I was able, even though I didn't understand the report at the time, I was able to learn and take pieces of that report to learn what the pieces meant, learn what the stainings were, and to find that I currently in my report, I think was listed as a unclassified oncocytic renal neoplasm, even though it looked just like an oncocytoma. So I did do some learning on my own to try to find those things out, which allowed me to understand that I should probably go for a second opinion once I realized kind of how rare what I had seemed to be. Where I learned the most, honestly, was connecting with other kidney cancer patients through support groups, as well as watching webinars or information from providers who see kidney cancer that were shared kind of across the internet in different platforms. A couple of them were on rare cancers, and I was able to learn from them. So I learned a lot that way as well, too. And definitely that information was much better for me to be able to take back to my physicians to be able to confirm or see how it related and pertained to my case than a broad Google search that definitely sent me down a few rabbit holes a couple times.
How did you decide which oncologist that you would go to for that second opinion? As patients, we all go into that dark space and we become paralyzed often. I mentor a lot of patients and people don't know where to go. Even oncologists who get cancer don't know what to do with themselves. I'm mentoring a researcher right now, but game over when we get that call. But you have info to share for people listening if they want to get second and third opinions, especially with rare cancers. Where did you find the most guidance? Where can people look?
Yeah, I actually recorded an episode talking about this exact topic because it is so complex and I didn't know at the beginning. So when I first got diagnosed, I Googled best hospitals for kidney cancer, best cancer centers for kidney cancer. And those things, they're not necessarily bringing the physicians up on these lists, and they're not exactly probably the best place to gather a lot of that information from what I've found. And so the best places that I've found information is by getting involved in community groups as well as with advocacy organizations, people who have been in the space long enough that they know who the experts are in order to be able to help kind of put you in touch with them. So I got many, many second opinions actually. And so further down the line is kind of where I got the referral based ones from either an advocacy organization, or I heard feedback from other patients who had been seen at academic hospitals or something like that, especially with rare cancers. Sometimes you want to be a little bit more niche where you're being seen. And so I think for me, I got more information relying on other patients who'd been through it before, who maybe had found specialized care that they really appreciated or thought was going well. as well as advocacy organizations. There's several organizations that help put me in touch with different people. There was one that put me in touch with my oncologist that I have now. And then there was a different advocacy organization that actually put me in touch with the NIH, and was how I got to where I am currently. I ended up having a very, very large surgery that got me to where I am now through the NIH. And so I think kind of relying on other people is kind of my biggest piece of advice there. When I first went down to MD Anderson, I actually called the general line and told them I had a really rare kidney cancer and was looking to be placed with somebody who was a little bit more specialized in that area. And I ended up being placed with just the first oncologist that had a spot open, because the scheduler, the most important thing that they heard was that I needed to get in as soon as possible instead of a little bit more specialized care. The oncologist was brilliant, but it just wasn't the specialized area that I needed to be into. And so that's kind of the piece that I really learned of, like, it's very, very helpful to know maybe who you want to go see before you call and make those appointments. And how you find out the who is by kind of through networking or through these advocacy organizations that really understand the space a lot more.
Can you tell us more about the approach in deciding between enrolling in a clinical trial or pursuing standard of care? What are the pros and cons, the options that you all weighed, and the direction that you headed down and that you're in now, having stage 4? I'm sure you're still in some form of treatment. Would you share what the process was like and what the standard of care that you chose, or was it clinical trial?
Yeah. So for me, I was initially looking for a clinical trial when I first got diagnosed. And part of that was because I had this rare type of kidney cancer. And a lot of the rare kidney cancers, the standard of care has been updated in some of them. Some of them have more specialized treatments because each type of kidney cancer responds so differently to treatment. But there was some suspicion that I might not respond to some of the current therapies like immunotherapy due to my specific subtype and kind of the biology of my disease. And so as I was looking at the beginning for what treatment options might be available to me, the standard of care was kind of for an older drug at the time. And so I was looking for clinical trials to see if there was any other options that might be trialing something a little bit more specific or a newer treatment. And the original institution I started at didn't have any clinical trials because what I had was so rare. At the beginning, we were looking in a bucket. My tumor was kind of in this unclassified bucket. And so there are some trials that can be tried on unclassified, or sometimes in the non-clear cell or variant histology, which is kind of this broader bucket. So MD Anderson had a trial once I went down to MD Anderson, which is where I went for a second opinion. They did have a trial available to me there. And that trial was evaluating a drug that was already approved broadly for kidney cancer versus one of the older drugs to kind of establish a new standard of care for this rare subtype and subset. But both drugs were available to me. And so my personal decision went based off of, did I have a preference for which of those drugs I wanted to take, since both of them were available to me out of the trial? And then were there any extra things that I had to do in the trial that I may not have wanted to do? So for me, I didn't want to be on birth control, which was a requirement of the trial, just because I didn't want to add another variable into play for my own care and treatment. And so for me, I chose not to do that trial because I had access to both of the drugs anyways, and I had a preference for which one to do. However, I have also participated in device trials. For example, at the NIH, one of the clinical trials that I participated in there was an imaging trial while doing ablations for tumors in my liver, where they kind of overlaid two types of imaging to try to get some better targeting. So I did participate in that trial. And then there's many other trials that I would participate in. I think the biggest thing when looking for a trial is seeing how much it relates to your specific disease. And that's kind of where getting more information, oftentimes through networks or through these organizations, can really help to try to help understand and evaluate these things. Obviously, talking with your providers, they can provide that context as well. And then the other piece is also sequencing of trials. I personally feel like is very important. There's some trials that you can only do for your frontline treatment. And so if there is a trial that you want to participate in, knowing if those drugs or that trial is only available for the very first treatment is also very important, to make sure that you don't disqualify yourself from future trials. And they all can kind of be dependent on each other. So it's, especially when you're very first diagnosed, it's such a complex area to navigate that I really feel like connecting with other patients and then always relaying that information back and forth between your providers can really help tease out a lot of that area, because there's just so much to learn before you make those decisions during a very, very short period of time.
Incredible knowledge and information, and what a journey you've had. And I have to do a shout out to your oncologist. I mean, he is a 2-time Conquer Cancer grant recipient. And that's why I'm involved in Conquer Cancer. This is truly from the heart. I believe without research, you and I would not be having this conversation today. And research saves lives. You and I are both living proof. How are you feeling right now?
I feel amazing. I'm very, very, very fortunate. And many kudos to my oncologist, because as much advocating and everything that I have done, a lot of that has come from learning from him as well, too. He's not only an incredible physician, but he also shares knowledge and really tries to help level up knowledge for everybody as well, too. For me, I'm very, very fortunate. I got to a surgery about 6 months into my diagnosis, which was not typically standard of care. So I ended up having that surgery at the NIH and the NCI. And we removed my right kidney and did about 5 wedge resections of my liver. So cut out about 5 sections of my liver. And then we ablated or burned 10 tumors in my liver in that same procedure as well. And then a few months later, we went back and burned about 5 more in my liver. And so after that surgery, I actually didn't end up going back on treatment. I currently have no evidence of disease, and we've been just watching and surveilling. I'm just on active surveillance, but that's been able to keep me off treatment for a number of years. It's been about 2.5 years or so since that last procedure to burn the tumors in my liver. So I feel incredibly, incredibly fortunate to be able to have that time off treatment. I was on treatment for a short period of time before I had that surgery. So I do know what it's like to be on treatment and manage all the side effects and everything like that, which I think gave me a different perspective on the other side of it, and recognizing how fortunate I was to not be on treatment and to capitalize on that time as much as I possibly can, because I know how lucky I am to be here.
So you say you're not on treatment. Are you on any medication right now?
No, know how ridiculously fortunate I am to be in the position that I am, that I'm not on any medication, not even like over the counter medications, nothing. Like I'm very, 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 very fortunate.
That's fantastic. How long since your original diagnosis that you had this rare cancer?
Yeah, so it's been a little over 3 years since my original diagnosis, December 31st, 2020. And then I had my surgery June 29th, 2021, which was about 6 months later. So it's been quite a while. I ended up starting treatment after I got diagnosed about mid-March, and was only on that treatment for a couple months before I ended up making it to that surgery. But since that surgery and those ablations, we've been watching and just doing surveillance scans for me.
How do you feel leading up to your scans and the time afterwards until you hear how you're doing?
I always get nervous during that period of time. I definitely have my fair share of scanxiety. And I've learned kind of different coping mechanisms over time. Initially, when I was kind of first out of surgery and first diagnosed, I depended everything on those scans. And I felt like I couldn't live life until I got answers from the scans. And then afterwards, like within a week, all of a sudden would be worried about it again, and still felt like I couldn't do anything until I got answers and knew how I was doing again. And so it really limited me at the beginning because I was so worried about everything. But eventually I had a shift that came from a number of different reasons. But I started to essentially use my scan schedule of like my window of certainty. I knew my treatment wasn't going to change in that period of time unless something catastrophic happened, which I would know. And I knew I had that period of time before I would have any answers anyways. And so I started using that time period to try to do as much as I possibly could in that 3 months. And so I set goals. I started with really small goals at the beginning, just to like be able to accomplish anything during that period of time was a win. And then slowly over time, I've built that up. So now I kind of use each of the scan cycles I have to really pack in as much as I can to accomplish as much as I can while I'm in this window of certainty. And that's both helped me accomplish far more than I ever thought was possible, but it also has kept me distracted. It usually gives me something to do all the way up until I go for my scans. And then usually the window between getting my scans and getting my results is the one that I get most anxious in now, just waiting to see what's going to happen next, because I usually only let myself plan until that point, and then I'm kind of just waiting to hear what's next from there.
You are so impressive. You appear to be years beyond your age, emotionally, intellectually. You're just such an inspiration. I just can't even begin to tell you how impressed I am.
That was very kind. Thank you.
It's really important, as the healthcare community has realized, to treat the whole person, not only treat your physical health, but your emotional health. What are you doing and what have you been doing? And do you have any tidbits of wisdom for others who are facing a cancer diagnosis?
I've struggled with different things during different periods of time. And honestly, for example, the scan schedule that I kind of used to kind of help, I actually had to develop that kind of on my own because I noticed I was really struggling with some of these things. And I had tried to go to different therapists in like a community setting just outside kind of in the real world and found not too many people had experience managing some of the things that I was going through. And so I actually very recently have reached back out and I'm trying different services through the cancer centers themselves. Those are really great resources for patients. For me, the biggest thing that has always helped me is connecting with other patients. I learned so much from other patients. And it was learning not only kind of about kidney cancer and learning about disease information from stuff that they had learned from their providers and just learning as a community there, but also just like not feeling alone. For me, when I was super, super distraught at the very beginning of my diagnosis, I was in a pretty dark place and it was really connecting with other patients. And honestly, even being so young, I connected with a lot of patients even through like Instagram and searching hashtags for those things. Because during that period of time, I just needed to know that there was somebody my age out there who was still alive. Like I just needed to know other people existed. And talking with those other patients really brought me a lot of hope. Patients who were further along in their diagnosis shared tips with me that they went through. So I think learning from other patients is really where I learned a lot. Advice isn't always perfect, right? Like it varies. I always took the pieces that felt most relevant to me or that I was able to revalidate in other avenues and areas. And then I kind of just found what works for me. It does vary. Every patient, I think, finds what works best for them. And so I found tactics that worked for me over time. And then now I'm kind of in this different phase of my diagnosis of I'm not on treatment. I'm several years out of treatment. And so where I had gone from this period of time of, okay, I only can plan 3 months at a time, or now I'm at 6 months and now I'm getting involved in like multi-year planning and things. And so I'm in this weird space that I've now shifted into a new spot where I need to seek out those resources of like, okay, now how do I manage this part? Like, do I start saving for retirement? Am I still trying to plan for really short-term things? It's like a weird space that I personally am currently in. And so whenever I find myself navigating in a new area like that, I do typically reach out. So I reached out to my providers and they put me in contact with like cancer center resources. So I think speaking up and asking for help, not only connecting with other patients and kind of learning from their experiences, but also within the system is really important too.
I think that was extremely well said, because patients are afraid to ask for help. We all are. Many of us are strong-willed and used to doing things on our own, but there's nothing greater than not feeling alone, especially with a metastatic, rare form of cancer. So I commend you for asking for the help and knowing when you need it. I think we have covered so much. Is there anything else you would like to share?
If I were to share one piece of information or advice, I'd probably share something similar that you were chatting about earlier, and that's the importance of research. When I was initially diagnosed, there wasn't a whole lot of answers. I'm still in a period of time that there's not a whole lot of answers, but I mentioned we started modeling my treatment plan after another rare type of kidney cancer, which is chromophobe kidney cancer. That's the same type of kidney cancer that I eventually started my own nonprofit around. And that is because I recognized just how important research is and how much of an impact that people can make for these rare cancers. That's something that I didn't necessarily recognize or realize before I was diagnosed, what a small group of people it can take to kind of move these things forward. And especially with rare cancers and rare diseases, how much it really does. So it's really important to champion research, and you can do that in a number of ways. That's from funding grants. I've helped fund a couple grants. Those can be like making donations to foundations that help fund grants for those different things. But it also can just be advocacy and awareness, kind of as we've been talking about here, just sharing about kidney cancer, sharing your stories, and putting information out there is really, really important. And then there's also avenues where patients can donate tissue to research. And there's just so many different pieces that if patients want to get involved and help support research and move it forward, they really can. And I'll say in the last 3 years since I've been diagnosed, I personally have even been able to see a shift in the landscape of research, especially for rare kidney cancers, and seeing how much that has changed by people very fiercely championing these diseases and moving research forward, funding research forward, is mind-blowing how much that can change in such a short period of time. And that would not happen if it didn't have people behind it, championing it. And so I'll just say it's a very long, rambly way to say how important research is. But I know I didn't really understand it when I first got diagnosed. It kind of seemed like this big black box. I didn't know how to get involved. I didn't know how to support it. And so connecting with others, and especially advocacy organizations, can really help anybody who wants to get involved in helping to move things forward and make things better for other people.
That was beautifully said. I mean, that is what this podcast is all about. I have one other question. What does conquer cancer mean to you?
To me, conquer cancer means changing cancer and the treatments that are available to be able to bring curative or durable responses to patients in a way that doesn't currently exist for everybody today. So that's being able to make it so cancer doesn't disrupt the lives of those of us that are affected by it, because we have treatments, we have options, we have ways to manage and eliminate that, and making sure that that's not just for some type of cancers or some populations, but that's for everybody and accessible to everybody. That to me is what conquer cancer means, is making it so that that's not disrupting the lives of anyone.
And you are doing an amazing job at conquering cancer. You not only are surviving, as I said in the beginning, I can tell you are thriving, and I wish you only good health and happiness and a great journey, and live every day as I know you're doing, and keep giving back, because I hope everybody starts following you on Instagram. What is your Instagram?
My Instagram is Katie Kicks Cancer. I'm on a bunch of different platforms, and Katie Kicks Cancer is my handle on all of them.
That's great. Well, Katie is definitely kicking cancer, in my opinion. Thank you so much for being on with us today. And may one day no one ever get diagnosed with kidney cancer again.
Yes. And thank you so much for having me. It's been wonderful chatting with you.
Thank you for listening to this podcast brought to you by Conquer Cancer, the ASCO Foundation. Conquer Cancer is creating a world where cancer is prevented or cured, and every survivor is healthy. You can make a gift at conquer.org/podcast. The participants of this podcast report no conflicts of interest relevant to this podcast. Full disclosures can be found on this episode page on conquer.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.